Hello and welcome to this session. Today, we'll focus on LO5, be able to analyze stakeholder responses to organizational change. In health and social care, change doesn't just affect systems, it affects people. Understanding how stakeholders respond and why they react the way they do is essential for implementing change successfully. In this session, we'll explore how to critically analyze those responses and what they mean for effective change management. Begin by identifying all stakeholders affected by the change. This includes both internal and external parties. Categorize them based on their influence and interest. This helps prioritize engagement efforts. Tailor strategies to their potential impact on the change. Gather data on stakeholder responses using surveys, interviews, and feedback forms. Ensure the process is transparent and respectful. Consider both qualitative and quantitative data. This provides a comprehensive view of stakeholder sentiments. Respect their concerns and preferences during data collection. Analyze qualitative data for themes and narratives. Quantitative data helps identify patterns and trends. Assess attitudes to determine if they are supportive, neutral, or resistant. Identify reasons behind these attitudes. This analysis reveals common themes across stakeholder groups. Recognize the role of cultural and diversity factors in stakeholder responses. Cultural competence is crucial in addressing these factors. Analyze how they affect stakeholder reactions. Consider linguistic diversity and its impact. This understanding enhances engagement strategies. Identify key concerns and challenges stakeholders raise. These may relate to roles, responsibilities, or job security. Prioritize concerns based on their impact on the change initiative. Address them proactively to support successful implementation. Understanding these challenges is crucial for effective change management. Evaluate stakeholder engagement levels. Are they actively participating or disengaged? Consider their involvement in decision-making processes. High engagement indicates support for the change. Disengagement may signal resistance or indifference. Develop strategies to address stakeholder concerns. Modify change plans if necessary. Provide additional information and support. Communicate how feedback is integrated into the process. This builds trust and fosters cooperation. Continuously monitor changes in stakeholder sentiment. Adjust engagement strategies as needed. Open dialogue encourages ongoing feedback. Create channels for stakeholders to express thoughts. This ensures their voices are heard throughout the change process. Document stakeholder response analysis, including key findings and trends. Share these insights with leadership and relevant teams. This informs decision-making and strategy adjustments. Transparency in findings builds organizational trust. It also guides future change initiatives. Adjust the change plan based on stakeholder analysis. Address concerns to improve success likelihood. Ongoing analysis ensures responsiveness to stakeholder needs. This proactive approach supports effective change management. It enhances the chances of successful implementation. Assess possible risks associated with change processes. Identify common risks like resistance, budget overruns, and technology challenges. Develop mitigation strategies to address these risks. Effective risk management ensures successful change implementation. Regular assessment helps adapt to emerging challenges. Conduct a stakeholder analysis to understand resistance. Identify who is affected and their level of influence. Map stakeholders based on influence and interest. Analyze perspectives to anticipate resistance sources. This informs targeted engagement strategies. Appraise strategies to manage resistance to change. Clear communication and stakeholder involvement are key. Education and training empower staff to adapt. Identify and address resistance concerns proactively. Tailor approaches to specific organizational contexts. Evaluate quality systems, policies, and procedures in healthcare. Regular monitoring and stakeholder involvement enhance effectiveness. Adaptability and communication ensure systems meet organizational needs. Patient-centered approaches improve care quality. Continuous improvement efforts address evolving challenges. In conclusion, we have learned that analyzing stakeholder responses is essential for achieving successful change in health and social care. It requires carefully identifying their concerns, understanding their perspectives, and adapting strategies accordingly. By actively engaging stakeholders and addressing their needs, organizations can build trust, reduce resistance, and ensure effective and sustainable change implementation. If you have any questions, please feel free to contact us via WhatsApp at 0748 436 1688. We look forward to seeing you at the next session. Thank you for your attention.